Superintendent McGee, go ahead.
Hey, good evening, everyone. I know you're joining in. We're starting just a few minutes late. We've got a lot of folks in our inner circle here, so we needed to get everybody straightened out. So we're good to go. We're happy to have you here. Um, uh, Peter, just a quick question, logistical question. Do I need to wait for the attendees to all load up before I begin, or can I go ahead
Yes,
and start?
the attendees are rolling in. We have approximately 330 that have registered and about 160 have come in. So if you'd like to give it a minute, you can.
Okay, great. We're looking forward to a really informative evening. Also tonight, we are building partnerships and relationships in this work looking ahead into 2021. So we will, I think I'm going to go ahead and share my screen and so that we're all ready for the, let's see, let me go back. There we go. Okay, good evening, everyone. Thank you for joining us. Tonight's event is really unique. It's actually a planning webinar, and we're doing it in a sort of what we call a fishbowl style. So we're going to have a conversation on the screen here. The audience, as you're coming in, you're going to be our listeners. The only way for you to engage tonight in the conversation will be at the end of the session through a electronic survey. That survey will come up on your screen as soon as you click out of the webinar tonight. We'll also share the URL in case you want to take the survey early. And what we're doing tonight is we're gathering information for planning a series of informative webinars in 2021 to support the success of schools as they emerge out of 2020 and the depths of the COVID-19 pandemic. In order to do this, I'll go ahead and move to the next screen to talk about what the vision for this night is. We all know that COVID-19 pandemic has presented us with enormous challenges. One of the biggest impacts has been on our children and our schools. And to support our young people and our schools, we actually must join forces. We know one of us can do this alone. So the forces we're joining tonight are education, public health, academia, and our community health practitioners, some of whom are local San Mateo County pediatricians, with the idea that we're going to circle up around our students and schools because we are better together. You may know some things about what we've been doing in San Mateo County, but if you don't, we started early in the pandemic by producing a collaborative document between San Mateo County Health and the County Office of Education. It is the pandemic recovery framework, and out of that we developed the 4 pillars, which are health and hygiene, face coverings, physical distancing, and limiting gatherings in schools to ensure safe conditions. We've also signed a contract with Curative across the county to help support staff testing at scale. And we've been conducting contact tracing training and support. So tonight, we're really so pleased to have an amazing group of health experts with us tonight. I'm gonna, as soon as I'm done with these introductory slides, our Dr. Neil Patel and Dr. Curtis Chan, who are leading this team, will introduce those who are here tonight. And then we also have an amazing group of education stakeholders ranging from parents to principals to district leaders, superintendents, and board trustees. not to mention teachers and union leaders. So tonight, the program will do some introductions, and then we will engage in our discussion with our education stakeholders. Our health experts will be listening. We will start recording the session as soon as the discussion begins, because we're gathering data to inform our 2021 webinar series. And then we will hear briefly from our health experts at the end of the program tonight about their takeaways and what they're looking forward to in 2021. And you, as the audience, will be able to complete an audience survey. Speaking of the survey, I said I would share the link to that. It is a bit.ly link at Better Together 2021. This link will come up for you after we're all done with tonight's program, and we will also be emailing it out to all of the participants tonight. And we would love your feedback to help inform our series going forward. So with that being said, I would like to introduce our two health leaders tonight, Dr. Neil Patel, who has been serving as our pandemic recovery framework medical advisor through the last many months, and Dr. Curtis Chan, who is our new Deputy Health Officer in San Mateo County. Again, so grateful to have you here. Turning it over to you, Dr. Patel and Dr. Chan, for introductions of our health experts.
Sure. Thank you, Nancy, so much. I want to extend my deep gratitude for everyone for joining, and without any delay, I'd like to introduce some of our speakers. Correct me if I'm wrong, would it be right for me to introduce and then have the person being introduced say something briefly so that they come up on the screen?
Sure. You know, what you could say briefly is it's been such a challenging year for everyone, and everyone has to find a way to restore your mental health and your energy. So maybe you could just share what your favorite activity is to recharge.
All right. So it's my pleasure to so I will be introducing half of the physician experts, and then we'll round it off by Dr. Chan, who will introduce the rest. This is a group of community pediatricians and UCSF and Stanford physicians mainly. So first is Dr. Lee Sanders. Dr. Lee Sanders is a general pediatrician and associate professor of pediatrics at Stanford University, where he's the chief of the Division of General Pediatrics, and he holds a joint appointment in the Center for Health Policy, where he's the co-director of Stanford's Fellowship in Academic Pediatrics and the Center for Policy Outcomes and Prevention. Dr. Sanders.
Hi, thanks so much for inviting me to this. To recharge, I am cycling in the beautiful open spaces around San Mateo County. Thank you.
Thank you. Welcome. Next is Dr. Pedrez. Dr. Ryan Pedrez is a pediatrician and assistant clinical professor of pediatrics at Stanford University, Division of General Pediatrics. His primary clinical practice is at Gardner Packard Children's Health Center. In addition to that work at Stanford, Ryan also serves as the medical director of the primary school, which is a new integrated health and education model that serves low-income children and families in East Palo Alto. Dr. Pedrez.
Hello, good to see everyone. Thanks for including us. Like my boss, Dr. Sanders, I'm getting outside as much as possible to recharge at this time. So we're lucky to be living in this beautiful area of Northern California.
Welcome. Next, I'd like to introduce Sherry Sager. Sherry Sager is the Chief Government and Community Relations Officer in the Government and Community Relations Department at Stanford Children's Health. Sherry is particularly knowledgeable about healthcare issues affecting all people, particularly women and children, and is a strong pediatric advocate in the community.
Thank you, Neil. Happy to be here. And for me, it's just sitting back and listening to some good music.
Music, nice. Next, is Joey here with us today?
He was going to be here, but I have not seen him yet.
Okay, so I just will mention that Joey Vaughn is the senior manager of, works with Sherry Sager as the senior manager of community partnerships in the government and community relationships department at Stanford Children's Health. So we'll welcome him if he, whether he joins or not. Next is Dr. Jackie Chaya. Dr. Jackie Chaya is a passionate and thoughtful community pediatrician at Ravenswood Family Health Center. She's also a member of the local Academy of the Pediatrics School Health Committee and has advised neighboring school districts along with myself and Nancy through the San Mateo County Office of Education. And she's also been an expert speaker at Stanford Children's Hospital on safe school reopening. Dr. Chaya.
Hi, everybody. Thanks for having me here. Good to see some of you. So I think that so far this pandemic, I've been recharging in my basement that is now converted to a home gym. So been exercising it out.
Nice. Next, I don't think I see Dr. Ketterman. Dr. Ketterman, are you there? Dr. Ketterman also works at Palo Alto Medical Foundation, and she also has been an expert and helper with engaging school districts for being a content expert for safe school reopening. And she works as a pediatrician at the Palo Alto Medical Foundation in San Carlos. Next is Mary Ree with us?
She wasn't able to make it tonight.
Got it. Mary Ree, just so you know, is also a pediatrician at Kaiser. So we have tried to engage different institutions to help us on this effort. And she is also an expert and is passionate about masking in the young age group, aged 3 and above. And then I wasn't sure if Jim has joined us or not.
Looks like Jim is here.
Great. So Dr. Jim Howard is a pediatric intensive care physician at UCSF Benioff Children's Hospital at Oakland and a member of the Board of Trustees for the Belmont Redwood Shores School District. He cares for children with COVID in the intensive care setting in the hospital and is a leader committed to all students in San Mateo County. Dr. Howard?
Hey, I don't know what I do for fun. Go to meetings apparently on Zoom.
Nice. Next, I'll turn it over. Welcome, Jim. Next, I will turn it over to Curtis to round out with our UCSF colleagues.
So I appreciate you all being here. And as you know, nobody has a single right answer for the health and safety of teachers, children, and their parents and grandparents. But what we can do is be well informed and coordinated across our county and region. So that's why we're so grateful that there's leading health experts from Stanford, UCSF, our public health department, and community pediatricians who've joined us on such a short notice. So I know that, so I'm not gonna actually allow my current colleagues in SFMC to introduce themselves, nor my former colleagues at UCSF, because we all rather just listen to the school leaders, but I would just list their names really quickly. From San Mateo County Public Health Department, Doctors Catherine Solanov, Doctors Jean Lindquist, as well as, you can all wave, Jean Chevrolet, our nurse who's been looking over all the school outbreaks, as well as Liz Sanchez, our school liaison. So thank you so much for being here and all your work. As well as at UCSF, you could wave so we have leads from each department here, from epidemiology, Dr. George Rutherford, and from internal medicine, Dr. Vivek Jain, the chair of general pediatrics, Dr. Lee Atkinson McAvoy, infectious disease, I think might join us later, Dr. Ted Rule, as well as other pediatricians with different specialties, expertise, Dr. Liz Rogers and Dr. Sohail Sood. So as you can see, lots of experts, and they've all committed to helping out, provide technical assistance, provide lectures. They actually, in my mind, they could give a great lecture, international leading experts, and for 1 hour. They're used to talking for 1 hour, but they're going to listen for more than an hour and read your documents for more than an hour. So, so that's why we're here, to listen and learn from you all. So thank you so much.
Thank you, Dr. Chan. And we're going to move into the education stakeholders who are on the call. I am also not going to introduce everybody individually ahead of time, but when I engage you with the questions. We'll then do introductions, but I do have a question for those of you that are the education stakeholders on the call. You know, we have two things to worry about. We have a level of concern around safety on our school campuses and our health, which is obviously of top priority, but we also have great levels of concern about students not being on campus and learning in person. There's a lot of things that can go awry there, that kids can get behind, that they can be disconnected, and there's all kinds of potential impacts to their future. So I'm wondering about, you know, for those of you who are education stakeholders, if you were gonna rate yourself on a scale of 1 to 10 about your level of concern for the health and safety of your school campus, can you just hold up your fingers about where you rate yourself? Let's do it a 1 to 5, with 5 being the highest level of concern. And if you're an education stakeholder, can you put up your fingers and let us know where you stand with level of concern for health and safety, and hold them up so everybody can kind of see. Very good. We've got a lot of 5s. We've got a few 4s. Okay, let's go back and also do the same thing for your concerns for the educational impacts on children right now as a result of this pandemic. We've been in distance learning largely since March of 2019. What kinds of concerns, what's your concern level for the academic and educational impacts on children right now? 5 being the highest. Can you hold up your hand and make sure and keep it there? So what we've got is we've got a lot of 5s. We've got 1, 3, but mostly the rest are 5s. So we've got a 4. So that just kind of is a little bit of a temperature take for everybody on where we are as far as concerns. Where I'm going to start tonight is with our 3 superintendents. We have Gina Sedaria here tonight from Ravenswood City School District, Superintendent Bernie Vidalis from Jefferson Elementary, and Superintendent Amy Wolliver from La Honda Pescadero Unified. And I'm going to ask a general question for you all to answer. If we can do, you know, be succinct in this, and then I have a single question for each of you. But as leaders of your school districts, your communities place such a sacred trust in your decisions. As the one person who has to stand up in front of your entire community and interpret world conditions and communicate local decisions, what has been one of your greatest challenges as you've worked to honor and maintain that trust? We'll start with Superintendent Wolliver.
Thank you, Nancy, or Superintendent McGee. Maintaining a consistent messaging and stream of communication in the ever-changing world of COVID. Changing regulations, health conditions, county orders, state orders has been a real challenge. So to meet the challenge, I've committed to holding weekly evening office hours for my community since early July to promote transparency and honestly display the real vulnerability that I feel and I share and I live. So being able to connect with parents each week allows for a space where they can receive information, the latest information, as well as a space for them to vent, share their concerns, sometimes raise their voices, and just be able to hear from me what is happening. It's not an easy time to lead schools. We have a real awesome responsibility for the health and safety of our staff and our students and our families. And we face the impossibility of meeting the needs of all of our families during this time of distance learning and remote learning and COVID. So thank you.
Thank you. Superintendent Sedaria.
Thank you, Superintendent Nancy. For Ravenswood, we have a community that has put a lot of trust in the educators and they're highly well revered. And so whatever decision is made or whatever outcome happens, our goal is to ensure that we have that trust on the other end. And the challenge I have is we have a handful of families, we have a handful of educators who are ready to come back, but I also have a significant number of families and a significant number of educators who are fearful to come back. And each of them I want to validate as we try to mitigate how to bring all of our families and communities to a place where each of their needs are being met. So we have, we want to make sure, how do we address the learning needs of students in a safe way and mitigate that, as well as being able to say, you know what, your comfort level, we can serve you with your comfort level with remote learning, or we can serve you with your comfort level of learning hubs, or we can serve you with your comfort level with in-person learning. And so we want to be able to have the flexibility and the means to have the flexibility to serve various programs to best serve the needs of families and students and their comfort level.
Great. Thank you. Superintendent Vidalis.
Yes, thank you, Superintendent McGee. So I think it might have been Dr. Sager in our pre-meeting who talked about the amount of information that comes in and changes. And what will be shared today will only be the latest information and accurate as of today. So my greatest challenge is staying on top of that information. I read a lot, and I try to distill that for our community, staff, and our parents, and our broader community. And the biggest challenge that I found in that distillation of information is around public health messaging. Like we all know, stay home, save lives, don't see your mother for Christmas, don't travel outside of the county. All of these things, don't worship in your place of worship. All of these things, all of these don'ts that we hear loud and clear through news outlets. And then at the same time, I hear the messaging, it's safe to be in schools. Schools are a safe place. Children can be safe at school, staff can be safe at school. And those two messages make a little sense to me because I spent the time to understand the nuance behind that message. But the blunt messaging instruments that we have to get out that information don't allow for the nuance that is needed to interpret that message. And so I often feel like people just don't understand, and what is much stronger is the message of don't. Not that people are listening, but the message is don't do this, don't do that, you can't do this, you have to, stay away from other people. You can't even see somebody in your backyard anymore. So those are the kinds of messages that come across loud and clear. And it's hard for me to integrate a message of schools can be safe and should be safe for your child.
Great, thank you. So superintendents, I have more questions, but I'm going to circle back to you a little bit later in the conversation. Going to move on to our board trustees. We have Trustee Clayton Koo from Jefferson Elementary School District, and Trustee Linda Brocchini from Pacifica School District. So thank you both for being here. Thanks to you and all your board colleagues across the county for providing leadership to your communities in incredibly difficult times. And I think something many people don't actually understand about schools is that it's the local district school board that sets the direction for their district. And that in this pandemic, it's actually the school board that is taking action for whatever mode of learning your students are going to move into. And so I'm wondering, we'll start with you, Trustee Koo, as an elected representative with such gravity associated with your decisions. Can you briefly share one concern that keeps you awake at night?
Sure. Thanks, Superintendent McGee. To me, I think one big thing that I always worry about is if we were going to reopen our schools, how can we do it in the safest way so that our students, our children, our teachers, our staff don't feel worried about the potential of COVID in our schools. For example, even if they feel safe at school, there's potential that there might be immediate family members, parents, and people in the community that could potentially be impacted by COVID. So try to understand how best we can reopen our schools in the safest way, but also try to mitigate some of the potential fear or concerns that could potentially spread if they were going to go in school, even with PPEs, even with social distancing, even with fewer students in the classrooms. How could we do it in a way so that it wouldn't necessarily worry even more people if we were going to actually reopen our schools?
Great, thank you. Trustee Brachini, what keeps you awake at night?
Well, I think similar to Trustee Koo, there's a tremendous amount of effort going into making sure that all the stakeholders feel safe and that they find trust in each other. And what I'm concerned is that we spend a lot of time and effort in getting everyone back to school. And then within a few weeks, we have an outbreak and we have to send everyone home. And to me, that would really be devastating because we will have spent so much time trying to build trust throughout the community. And then they would just sort of be like, well, look, you guys didn't succeed. So I do have fear of that. That's probably one of my biggest fears at this point.
Great, thank you. So Trustee Brachini, what kinds of information and resources do you think you need to feel more comfortable in making the decisions? Without, obviously, no one can give a guarantee that, we don't live in a world that's 100% safe all the time. But given the COVID-19.
Well, I think if there's.
Did you freeze? So we'll pop over to Trustee Koo. What
I don't know if I lost my signal there.
Yeah, what information and resources?
Okay, I'm back. Are you there?
Oh yeah, go ahead.
Sorry. The biggest thing I want to do or figure out is how do we assure the staff that that everyone is actually adhering to the protocols. So just some sort of check or help to just make sure that that's actually happening. And I really think it's probably more about education and ongoing education throughout the process. Because, as you know, and as we spoke on earlier, things are changing daily, and someone may be still locked into a color code that happened 6 months ago and haven't really come around to where we're at now. So I think it's ongoing training and of the staff at all the levels, just to make sure that we have the trust within the community to feel safe.
Great, thank you. Trustee Koo?
I think to me, the answer is data, but not necessarily data in terms of more data. I feel it has to be data that is easy to understand and simple for that someone could actually make a decision off of it. I just think, especially right now, there's so much change in terms of increasing cases and deaths across the region, across the country. It's hard to figure out data as it changes literally on an hourly basis. And I think for me, just being able to get information that shows me what is happening in a simple way, but also being able to communicate that to the community. For example, looking at different types of ethnic groups or socioeconomic groups and seeing, are some groups being impacted more by COVID over others? And if I was going to take an action as a school board member, would that indirectly or hurt some groups over others? And try to make sure that in terms of my decision making, it is based off of what would be the best interest of all students and not just necessarily one group over others, just based off of some specific information I see in terms of the data coming out on an hourly basis.
Great, thank you so much. I'm going to circle back, Superintendent Sadaria, to the fact that we do have the pandemic recovery framework in the county, and the superintendents have been highly responsive to developing and training and communicating these safety protocols that people are talking about. I think that the protocols do support safe conditions in the school environment, but cannot account for the conditions occurring outside the school environment. So how are you balancing this, and what supports would help strengthen your overall community safety? In other words, you can't really control what your families are doing in their community. So how are you balancing that as people come onto your school campuses?
Great question. And I think the key word here for all of us is balance. And that's exactly what we're doing. So we currently have learning hubs on our sites with students on campus. So we are kind of showcasing to our community that school can happen, students can be on campus safely, informing our families that COVID is going to take place. People are going to contract COVID, but it's really ensuring that we educate our community about how COVID is spread and where it is not spread, and ensuring our families that safety protocols, safe surveillance measures are the barriers that prevent spread from happening in schools. And so it's emphasizing those two key factors and demonstrating that through our learning hubs. It's also very critical that the information that we receive from medical professionals is solid, sound, consistent, and as much information as we can get as educators to be able to push that out to the community is highly needed, and it needs to be quick, efficient, and very clear for all families to be able to understand. We are balancing people's own comfort levels, their own personal interpretation of information, and we have to meet their needs where they are. And so we're currently starting with the learning hubs and hopefully able to open up with urgent learners. But to answer the specific question around, what supports would be helpful to strengthen, we need student testing at no cost for our district, in addition to vaccine. Our community has a 17%, well, a high percentage of positivity rate, and we need to be able to address that. And we would like the city of East Palo Alto to be able to have a vaccine to mitigate that as much as possible and ease as much anxiety in our community so that we can bring back our students. As many of you know, students of color, disadvantaged students are 7 months behind, but in general are 7 months behind now because of the remote learning, but our Black and brown students are probably more than a year and a half behind. And we need to mitigate that as soon as possible. And any services like a vaccine or immediate testing at no cost for our families to be able to come back on campus is critical.
Great, thank you, Superintendent. Ms. White, you're a parent in the Ravenswood City School District, and I'm wondering what you've observed about your own children and how the upheavals of this past year have impacted them, whether it's built their resilience and been sort of a positive character building experience or something not as positive.
You want me to answer as a parent, as a teacher?
I'm sorry. I called the wrong stakeholder in Ravenswood. It's Miss Sabrasia that I'm asking. Yes.
So basically pointing out some of the positives and negatives. The biggest positive, my children are not going to school. They're not having interaction with anyone else. They're alive, they're safe, they're healthy. But the biggest drawback, I would say, is even just over the last week, I've noticed that my 9-year-old is getting really irritable and depressed. I call it depressed, but really irritable. And he's got ADHD and he's got an IEP, but the behavior has gotten a lot worse. And I think that it's finally gotten to him that he's not having any interactions with kids. And I think that it's finally starting to show its course. I also have a 16-year-old at East Palo Alto Academy, and he is doing his best with school. He just had finals this week, but it's been really hard for him not to interact with his teachers. Grade-wise, he's doing okay, but I can't, you know, we were in East Palo Alto. We have really high cases here. I can't let my kids even be around their peers in the neighborhood complex. So I think just the social aspect of it has been really hard. I know my kids are behind academically. They will be behind academically because of distance learning, but I think Ravenswood has done the best that they can. But I do know that they'll be behind, but I'm willing to take that risk for their safety.
Great, thank you so much. We're going to switch over to some of our district leaders. Don Scatena as the Director of Student Services in the San Mateo Union High School District. The operations at the high school level are so much more complex than a K-8 setting. Can you help us understand more about some of the barriers you've had to work through to try to bring such a large and diverse student population back to campus for in-person activities?
Yeah, I mean, that's a great question. I mean, what makes the high school experience so great for students is also what will restrict us, right? Having 6, 7 classes with various different student groups, classroom sizes from 35 to 45 students at times in PE, having 6 or 7 interactions in those classes a day, those types of things that students love, that interaction is actually very problematic in this environment, right? And so how do you then, teenagers are contracting COVID at a much higher rate than younger adolescents. And so that is of great concern. Those interactions present a barrier. So then you go to full distance learning, which is what most high schools have done, and then try to find ways to add learning hubs, add activities after school that allow for students to have like conditioning, to get out of the house, to interact safely outdoors in a controlled environment with masks on, with physical distancing. That helps because mental health is a major issue for students. It's the conditioning aspect, creating learning hubs for our English learners and our special education students. We've faced some challenges, but mostly we've had successes. I echo what Superintendent Sadaria stated, which is we need to be not comfortable, but understand that even though there is COVID or identified positive tests on the campus, we did not contribute to the spread of COVID on the campus because we're following the 4 pillars. And high school overall is an extreme. I mean, what we do need is testing, and it's really high stakes for high school students. We're getting students ready for college and career. The clock isn't stopping for them, right? I mean, it is going. And for getting the college admissions, things of that nature. So there's a lot of stress for students in regards to college admissions, where they're going to go to school, how this is going to affect them down the road, and then obviously learning loss that we have to take care of due to the pandemic and distance learning.
Thank you so much. I'm going to move over to Bonnie White, who's the district nurse in South San Francisco Unified. Bonnie, you have a really unique position. You represent such a critical educational service as a district nurse. Like many specialty credentials, though, we know that many schools and districts are understaffed in this way and some do not even have nurses. So I'm curious how you describe how you're adding to the solutions and the action plan as a district nurse in your COVID-19 response? Oh, I think you're muted. There you go.
Thank you. What I've been trying to do to support the staff and the students is there are several things actually, and probably more than that, but we've just started COVID testing, and we tested the staff at the district office yesterday. I have 7 health technicians, and they're going to be trained in January to do COVID testing. So we'll be working together to do all of the staff in all of the sites, the school sites. And the other thing that I've been working on is trying to get doctor's orders from parents so that I can write care plans so that we can have IEPs that are complete, and also so that teachers will be able to identify students who have health conditions such as diabetes and epilepsy, and to be able to distinguish or to see, or let's see, I'm trying to think of the word, to understand what the symptoms might look like if a child is having a problem with one of these or a condition. And so that they'll know who to call and what to do if that happens. So I've been working on trying to work on those care plans so that the teachers and the IEP teams have those. And the other thing is with the vision and hearing, because the kids aren't in school right now, I devised a questionnaire for parents. So I'm doing screening through the parents on the phone and filling out the questionnaire, and then to see if kids are having problems with vision or hearing at home, and then sharing that information with the IEP team so that the IEPs are at least complete as far as vision and hearing goes. That was the only thing I could think of to do because I can't do vision and hearing screening. And I'm always available for consultation to the staff and parents as well. So those are the things I'm doing to support the district.
Great. Can you add, since COVID-19 obviously everyone's jobs has changed, but
Yes.
do you feel that it sounds like South San Francisco Unified has a district nurse and a number of health aides.
Yes.
Do you feel like you have enough resources in that space?
No. We just hired 3 new health technicians, and they start January 4th. So I'll be training them, and we are looking for 2 more nurses, and they're very hard to find.
Yeah.
So right now I'm the only nurse.
Okay, great. Thank you so much.
You're welcome. Thank you.
We're going to jump over to our principals. We have 3 principals on tonight. Principal Framani, who is a principal in San Mateo Foster City. Am I right about that? Principal Cundiff is a principal in Pacifica School District, and Principal Brady is a principal in Hillsborough, Crocker Middle School. So principal, who would like to answer a question that has to do with distance learning and one thing that you find continuing to be a challenge with that? Somebody who you just want to like raise your hand who wants to take that question of the 3 of you. The question is, can you address one thing that is working with distance learning and one thing that continues to be a challenge?
I'd be happy to address what's working.
Sure.
Hi, everyone. Good evening. Currently at Crocker, we have just begun bringing back students by grade level. We will complete our 8th grade level tomorrow. And the way that we have done this is we've been able to offer options to our families to do in-person or distance learning. So our teachers are currently teaching weekly distance learning, a virtual classroom cohort or team, and then 4 teams of in-person students. So one of the things that we found that has really worked, and this was after a lot of planning and reflection from March, is the use of a school-wide learning management system. We found that in March, as we all had to go directly into distance learning, that one of the things that we brought through the summer and planning and brought into the fall was that we would all use Google Classroom. The school-wide learning management system has been really effective in supporting student engagement, allowing parents to engage as partners in their child's learning, helps us with students who struggle with executive functioning, and also has strengthened the executive functioning skills of our middle schoolers. We also have felt that it's really improved communication amongst our teachers as far as collaborating to support students so that they're not, if they're falling through the cracks or if they're missing assignments, they have that tool to use, and also they can, we've created smaller learning communities and built houses and teams. And so this helps us to communicate and progress monitor our students in a more direct way. I think it's also really promoted collaboration with our teachers, and they're sharing ideas and things that they're using in the technology, the tools of Google Classroom. And so those are some things that I would identify as positives of distance learning. And I would end with one of the things, it's made for that seamless transition. For example, we'll be in distance learning for 2 weeks after the break, and our students that are in person will return to distance learning and then come back into in-person. So we have that seamless transition.
Great, thank you so much for that. I'm going to ask a different question, Principal Framini. Much like your district superintendents, your role as school principal puts you at the center of the public messaging and balancing different and often competing priorities. Can you share an example of such a situation and how you navigated through it?
Sure, thank you. So my priority prior to March was to be an instructional leader, and that's where my training is and my knowledge base. But in March, I had to make a huge shift and lead with health and safety. And that is not my background, nor is it my training. And so I've had to rely on the pandemic framework and all of the information from my district to share that information with my teachers and all of our support staff. And what I'm finding is that's not enough for teachers and support staff to feel confident that it's safe to return to in-person. And so what I need is data. I need scientific information that I could share with my teachers, my support staff, my parent community, so that they are confident to return in person. Especially because that's not my background, right? And so I need that support to bring my community together.
Great, thank you. Principal Cundiff?
Yes.
So what would you, can you share an example of, just being caught in the crosshairs of all the different competing priorities and how you've managed to navigate through and what you need to be successful going forward?
So I think it's just trying to make sure that the needs of the kids are being addressed. So, making sure they have the resources to get online, the hotspots, the computers or laptops, making sure that they know how to get into the Google Classrooms, into Zoom meetings, that they have their links, that there's an easy way for them to join, and that we've had to create systems so that we know who's falling through the cracks. And so we've developed Google Forms and systems so that teachers can report it. We meet regularly to check in. We have systems for calling families and checking in. We've had to come together as a team, really, to using classified staff to do translations and really get the communication there clear. And I think, we're still, missing some kids, right, that are either not showing up for classes or showing up and not really engaging. And there's a lot of mental health. Somebody mentioned depression. We have kids crying, saying they don't want to go to Zoom, they don't want to go to school in this kind of format, and just trying to address those kind of needs. So we're using our counselors and our school psychologists and trying to come up with ways to get kids to be engaged in their learning. And I think working together as teams has really helped that.
Great. Thank you so much. We have 3 teachers tonight who are each of them leaders of their bargaining units. We have Paul Hagan, who is a teacher leader in Jefferson Elementary. Monica Casey, who is the teacher leader in Jefferson Union High School District. And Rhonda White, I apologize for calling on you earlier, Miss White, who is the teacher leader in Ravenswood. And I want to see if we can get a couple of questions to each of you here. If you could answer this first one really briefly. It's what is one priority that you, as not necessarily as a teacher, but a representative for all teachers in your leadership position, what are you most focused on right now for helping your school districts move forward in your school operations? We'll start with you, Monica.
Thank you. I don't know if I have one thing, but let me just mention that I'm also the teacher leader, but also for all of our staff. I represent all of our staff. So, you know, paraprofessionals and office staff as well. And so I just want to really mention that all of the educators and education staff needs vaccine and testing and tracing. And, you know, we have information in our general county, but we don't necessarily have it by zip code. And we're at the north of the county, and we are lower socioeconomics. We have, you know, some different situations. So I think that's the information that we really need to move forward.
Miss White, how would you respond to what's the thing you're most focused on right now in helping to move forward to the next step?
Thank you, Superintendent McGee. I could have answered the earlier question. I am also a parent in Ravenswood. That's why I wasn't sure. I was like, I make sure. So I have 2 kids in Ravenswood as well. So I could have went either way.
Well,
I think
let's hear about your kids too, then, how they're doing.
so. I have an 8th grader who has amazing teachers who he doesn't like distance learning, but he loves it because he doesn't have to wake up really early. And the piece he misses is his friends, the social piece. And he's not my social butterfly, but the academics, he can get online. He has a robotics class. He has Spanish. So he's able to get all his learning needs met as best as they can in remote learning, but he misses the social piece. And he's not my social butterfly. Now, my 4th grader, however, is at Los Robles Ronald McNair, dual immersion, and has been in dual immersion since preschool at 3. The social butterfly of the family, she can't wait to get back to school. It's killing her. So, but the academic piece, we're working through, we're learning, we're trying to figure out. But the language lost for her is what I'm the most concerned about, her second language that she's learning. So that is my kids. They're distance learning, pandemic, 2020 experience. Far as my teachers, I only represent the teachers. However, I'm always speaking for the whole staff of Ravenswood. I think one of the biggest things is what one of the other principals said. I can't remember the lady's name, is being more educated on safety. As educators, our role is education and assessments, informative, intervention, math, science, social, emotional, mental. And so when you say safety, we have the basics, but this is a whole nother level. So for me as a teacher leader, it has really been since March holding weekly meetings that the teachers can attend to update them on the framework, on the colors as they're changing, on the positivity rate of East Palo Alto, which is totally different from anyone else in the county. from what does it mean to contract COVID? What does it mean to spread COVID? What about tracing? So all of this is new, and I see, and it seems like every time I attend a meeting, which is at least once a week, I learn something new. Every time someone sends me an article 3-4 times a day, I'm reading something new. And so I think that is the biggest thing, is the safety and the ever-changing news and those things. I'll stop talking.
Great, thank you so much. Mr. Hagan, what would you say is your primary focus in representing your staff in Jefferson Elementary?
Well, thank you, Superintendent McGee. I have to agree with Monica. It's hard to say one, but I mean, obviously, safety is our top right now. This is what we spent hours and hours in negotiating with the district to establish safe metrics and safe procedures for coming back. Safety, what we need is along that line, student testing, adequate case tracking, so that we can, really stop this thing, not just identify where it is, but stop it. But equity is my other real concern. And the more I learn and the more this goes on, the more concerned I am about equity. I feel like we are all being pushed to reopen for a number of reasons, and they're good reasons, they're valid reasons. But we're not looking at everything. And in our rush, there are going to be people left behind. And yes, we have at risk or at promise students that need to be back. They need this. But we also have students and families who, if we don't get their buy-in, if we do not have them, if they do not believe that it's safe, we know from looking at its districts that have reopened, if the community doesn't buy in, who comes to school? Mostly the white students. In areas where you have a range, you get the white students come back. Often the students of color, where it's a lot harder to make these people feel safe. These are people who don't feel secure and safe within our medical system. So, I mean, that's just one aspect. But there are a number of, we're talking about equity, but I think we're looking at it through a very narrow lens. So that's kind of where I'm seeing it.
Great, thank you very much for sharing that. Ms. Goodman, as a parent, can you describe, you're a parent in San Mateo Foster City? Am I right about that?
Yes, that's correct.
Yeah, can you talk a little bit about, your who your students are and just a little bit about who they are? And then I have a question for you.
Sure. So both of my kids go to Fiesta Gardens International School. It's a Spanish immersion school. They've both been there since preschool. And my daughter is in 5th grade and my son is in 1st grade.
Great, thank you. And so where are you in the sense of when it's time to send your kids back to in-person learning? What's most important to you in order to confidently send them back to school? What do you need as a parent to send your kids out the door?
So for my family, I think the decision we have made is that our kids will go back when everybody's been vaccinated and school can safely, fully reopen for everybody. And it's not just because of COVID that we're making that choice. It's also because with distance learning now, although it isn't perfect, we were able to find pods for both of my kids. They have a routine that we've established since August that seems to be working really well for them. The behavioral problems that my son was having because of distance learning in the spring have persisted, but they have gotten better. And we have a pod leader who cares very much about him and with working with him to get him back on track with how he's behaving around other kids. So also because we have childcare right now that gets us through most of the day, what we had pre-pandemic, my husband and I can work full time. So yeah, until the schools fully reopen, our kids will be doing distance learning.
Great, thank you. I'm going to go back to you, Superintendent Vidalis. We have just a few minutes left, and your district, I believe, has established clear metrics in order to move ahead with a hybrid in-person model. And I'm wondering about, with the promise of the vaccine ahead, how do you anticipate that this information, this additional safeguard, will influence your district's course forward?
Yeah, so you started off the session by asking us questions. What's our sense of urgency around academics? What's our sense of urgency around health? And that was the conversation at the board level. What are we going to prioritize? And our board at that time decided to weigh in on the side of health and safety. We serve a community that lives in multi-generational housing. We have many of our families live in multi-family situations. We don't have a lot of single families living in single family homes. We have multiple families living in single family homes. And so one case of COVID in that situation can spread rather quickly, and it has, not because of schools, but just because COVID is very prevalent in the community. A lot of grandparents and aunties and uncles that live close by. And so for the conversations where, and Mr. Koo could add, what keeps me up at night is not that the kids will contract COVID and have a fatal result, but that they might contract COVID and spread it to their auntie, their uncle, their grandma, their grandpa, and they will have the fatal result. Because they share living quarters. And that's something that I found really hard to accept. I did not want one of our decisions to lead to that result. So our board decided back in October, as soon as we saw many school districts saying, we're going to open November 1st, like, oh, no, we're not. We're going to open January 1st. Oh, no, we're not. We're going to open January 20th. That the date thing just didn't work for us. Because the date is just arbitrary. It's just a date on the calendar. So we decided, the board decided that they would wait until San Mateo County was in the yellow. And because we are right next to San Francisco County, that San Francisco also be in the yellow. We have, our families are very mobile. Daly City empties during the day. Probably half go into San Francisco and the other half goes south, probably as far south as San Jose for work. And so we needed to keep both of those county metrics in mind. And so, yeah, the vaccine, I think, will be a help. And I would just feel most comfortable if all of the older adults who live with any of our school age kids get vaccinated. Once that gets taken care of, then I would just feel very comfortable. Of course, our staff, our older and vulnerable staff as well, but mostly those in their homes that they spend most of their time not socially distanced, not masking, and your family. So you need to touch and hug and jump on each other. So.
Exactly. Thank you so much. Superintendent Wolver, gonna go back to you. Quite a year you've had in La Honda Pescadero. You've been implementing in-person learning in some fashion since June, which required extraordinary measures because you're on the coast side, you're rural, so you've got all kinds of digital connectivity and transportation challenges to get your kids to school. And then in August, the CZU lightning complex fire hit your community, and your entire school district was evacuated for several weeks. I feel on the verge of tears just saying it out loud. Can you talk about how you overcame some of these incredible barriers to keep providing in-person learning for your students?
Thank you, Superintendent McGee. It really came down to the importance of knowing and acting on our local conditions. We are rural, we're geographically isolated on the southwest corner of the county. Early on, we had very low and stable COVID positivity rates. And we opted to look more closely at our local conditions rather than the conditions in San Mateo County to make our decisions about reopening. We reopened for 4 weeks in the summer, June, July, which was successful, and it gave teachers confidence that we could reopen safely. We then launched into hiring additional teachers to lower class sizes. We blew up our master schedule at our middle school and high school so that we could reduce our student contacts and allow for that pivoting between open and distance learning. And we also opened many remote learning centers in barns. We brought the learning to the farms in our early days of opening. And then the fires came, and all 3 of our schools, as Nancy mentioned, we had to close. We were actually down for 2 weeks because all of our students were evacuated and half of our staff. After the fires, the county started to move into less restrictive tiers while we were seeing cases rise. And so we opted not to reopen at that time or to work towards a waiver to reopen because residents had moved into hotels and with family members all over the state. And so our rural bubble had just been popped in terms of the safety of the isolation of the community. So we began an aggressive testing and isolation program. We needed to know where the virus was. We're a huge district, 175 square miles, but only about 300 students. And this was in early September. We partnered with the county and as well as Puente de la Costa Sur, which is our local resource agency, to develop a testing plan. We test monthly. Our district staff tests our community monthly, and the Puente staff tests on a weekly or biweekly basis in location-based areas, ranches, farms, and then they also offer testing for anybody who might need it during the week. And then we isolated. And it was difficult because we would, not us, but Puente would move people to hotels to be able to isolate because we have a lot of shared housing. We're an ag community. And that started to flatten our curve so that we were able to start to reopen our elementary site. And now we have all of our K-5 and preschool classes open. So just knowledge is power. COVID spreads really easily through ag communities, as we've seen on news and reports. We have shared housing. We have family members and community members with underlying health conditions related to poverty. And we have ag is a close, people are working closely together. So being able to test and isolate cases made it possible for us to continue our strategy to reopen for the betterment of our students, because as Nancy mentioned, we have internet challenges, we have transportation challenges, and we just needed to get kids back at school.
Thank you, Superintendent Wolver, and thank you, all of you. Dr. Patel and Dr. Chan, I'm going to turn it over to you. See if we can have a few closing words from any of our health experts. And I just want to reiterate, I'm so grateful for this incredible circle up around our students and our schools by all of these professionals who have full-time jobs, and everyone is pulled in a million different ways to deal with this pandemic, but that you're coming together to support our schools and our students is very inspiring as we go into 2021. Dr. Patel and Dr. Chan.
Yeah, I just want to, I'm humbled, and I appreciate everybody for sharing your stories and opening your hearts to us. I think in the interest of time, for the physician leaders who are on the call, if there, maybe one person could share their thoughts briefly. I'll just look to see if there's any volunteer.
I'll volunteer, Neil.
Thank you.
Hi, this is Lee. My grandmother was a teacher, my mother is a teacher, and now my daughter is a teacher, and they've all taught me to listen. And I am also humbled, and I was trying to actively listen and take notes, as you guys have trained me to do. And I hope that we will do justice to that. I will teach back, as I've learned in a little bit of what I've learned, but I think my colleagues and I have been taking notes, and we really want to do justice to help deliver to you what you're asking for. I heard a lot about fears and worries about not just safely reopening schools, but also safely treating the communities in which your students live. We heard a lot about equity, which is of preeminent importance to all of us. I know my colleagues here share that. We heard a lot about the need for data to drive decision-making, and you're lucky that you have some researchers here who want to help you with that. Local data on efficacy of mitigation strategies and risks and high-risk groups. And also a call for direct services and both health-related services, but also to support the social and mental health and wellness of youth. And finally, information that is clear, low literacy, multilingual, and appropriate, not just for the staff, but for all of the students and families that you serve. Those are just my notes. I'm sure I missed things. We're going to be regrouping as a medical community to see how we can help support you. But just want to end with gratitude. I'm in such awe of what all of you do. So thank you.
And I'll turn it over to Curtis.
Yeah, that was great to get the Stanford perspective, and anybody from UCSF, and maybe we'll have, it looks like Dr. Rutherford, go ahead.
Sure, I couldn't agree more with Dr. Sanders. You guys are in a really tough place, and we understand it, and we're happy to try and do what we can do. I think I'm heeding Superintendent Vidalis's cautions about multi-generational households, and thinking about this beyond the kids and the parents to the grandparents and to older people who are living around them, who are the ones who are going to die from this, and are dying in large numbers in Los Angeles right now. So we have to be. I appreciate your cautions about being prudent, being deliberative, following the evidence, and following the local epidemiology. The data change all the time, and I realize it would be nice to have had one set of information in February that hasn't changed. This has changed so many times. We're working 18, 20 hours a day trying to stay ahead of this and trying to absorb what's coming out and redigest it. So we'll try and make it as straightforward as we can, but understand this stuff jumps around quite a bit as new data come in from all over the world. But I just want you to know that we understand that schools are embedded in communities, and what goes on in schools goes on in communities, and vice versa. And so you really need a holistic approach. And so, yeah, get vaccinated when you get a chance. But back to you, Curtis.
No, I just want to appreciate again that all of us are here listening to you. There's others who didn't make it onto the Zoom who are listening right now. And we're committed to listening more and working together. It was great to have both Stanford and UCSF faculty join our health department as well as community pediatricians. And they're able to join us because we actually talk to these folks all the time anyways. So let's get through 2020 all safely, and let's mobilize to a healthy 2021. So we'll turn it back to Superintendent McGee.
Thank you so much, Dr. Chan. To all of you who are on the call tonight, I apologize to the education stakeholders that we didn't have enough, we could have spent maybe 20, 30 minutes with each one of you, but we just didn't have the time. But your presence here tonight and your representation is huge for our students. And you have my deepest gratitude. Deep gratitude to our San Mateo County Health team who's on the call, been supporting us every step of the way in this county. And I really do believe that what's going to happen now is we're going to take, when we click out of the webinar, a survey is going to pop up for all the audience participants. So if you could please fill that out, and we will use that data as well as the information that we collected here with this conversation. We'll be shaping a series of monthly webinars. Some of these folks may be speaking on them, some of them may not, but they know who to bring in for different topics that we select. And in this way, with Dr. Patel and Dr. Chan and the County Office of Education and our San Mateo County Health folks, we will definitely be providing solid guidance moving into 2021, which does feel so much more hopeful. Grateful to all the scientists out there, the medical practitioners. It's been a year, and there's nothing more important than coming together in community around things that matter. So thank you so much for your time, everyone. We're going to end this session. We'll put out, once we get our webinar series shaped and planned, there will be plenty of advertising and marketing for all. So thank you, everybody. Good night. Go back to your families. Hopefully nobody has any more meetings today.
Thank you. We're better together.
Thank you, everyone.
Thank you, everybody. Thanks.